Doctor, I'd like to know if my dad exactly understands what's going on around him or not. Listen, I think your father understands what's happening around him, even though no one knows for sure. But I believe your father is deeply aware of what is going on. The kind of awareness that is not explicit, not stated, not verbalized. Even though it might come up and be verbalized once in a while, as sometimes he may say, "Sometimes I don't understand. I feel like I became stupid." But usually, he probably plays it down. Yes, because if we ask him, he'll go like, "Everything's fine, my memory is just fine." But then he will complain about feeling dizzy and confused from time to time. But he won't say anything about memory. Right, this is what happens most times. But from what I can understand from your father's behavior, I can say that he is aware. He has a precognitive awareness that his brain is not working as it used to. And you can perceive this from many indirect aspects of his behavior, like when he avoids difficult situations, as well as tasks, and things that are more than he can take on, like driving in busy places, managing family bank accounts, all sorts of things I imagine he doesn't do anymore, and he might have left to your mother. This behavior of relinquishment shows us that there is a certain amount of deep awareness that leads the patient to live in a condition of constant anguish. How would you feel if suddenly you couldn't remember what you did yesterday, a week ago, or a month ago? You probably wouldn't be able to understand the present moment either. And so he is incapable of planning the future, as the capability of planning what I'm going to do tomorrow depends on the awareness I have of what I did yesterday and what I'm doing now. So your father finds himself every day on the edge, living between a present he doesn't understand, a past he can't remember, and a future he is unable to plan. This leads to a condition of angst that is very hard for us to understand, but that we can easily find in many types of behavior that show the uneasiness of the patient. Are they all like this? Well, actually no. In fact, there are some patients, generally those with a higher education, that participated in activities demanding high cognitive efforts during their working life. So when these patients develop cognitive problems, they have a very strong sense of awareness, and they're able to confront the problem, at least during the first years of the disease. Obviously not in the following year. They talk and talk about their problems a lot, often almost in an obsessive way. And we can see that the level of anguish experienced by these patients is even higher.